Hello, I am Jessica Shelley, a nursing student at St. Andrews University, Laurinburg, North Carolina. This semester, in our ethical and legal course, we are given the opportunity to research a sensitive topic within the nursing field. The topic I was chosen was nurse suicide. The reason for this topic is because I am very aware of mental health, and proceeding in a career where my mental health could be at jeopardy heightens my curiosity for a reason. According to American Nurse Association, on May 1st, 2017, the Healthy Nurse, Healthy Nation program was created. The focus when the program was created was 6 pillars, ensuring that nurses will not only take care of themselves physically, but mentally as well. Those 6 pillars are physically active, rest, nutrition, quality of life, safety, and mental health. As a nursing student, learning the ethical reasonings behind critical thinking and critical decisions that are being made when caring for patients, this program, Healthy Nurse, Healthy Nation, is important because the rate and negativity that surrounds the career of nursing is growing by the day. Nurses are being overlooked with little resources for support and even smaller number of staff to cover every shift. Nurses are the ones that are face to face with patients. They are constantly challenged with the quality of care that they give to patients, making sure that every avenue is accordingly and ethically appropriate when deciding the proper care. Providing autonomy for the patients is important. It is one of the many things we are taught in nursing school, that the patient's care and autonomy to decide whether to or not in a treatment plan is provided to them. Due to these challenges, that nurses are stretched to unbelievable lengths. Some of those lengths can impact them mentally and physically. They will be faced with trauma, burnout in the workplace violence, bullying, inadequate self-care, financial stress, high workplace stress, loneliness, and a balance between work and life. Another thing that has increased in nursing care is the fear of harming patients, as well as depression and anxiety. The entire list are triggers that nurses go through on an everyday basis. A place of feeling unsafe, unappreciated, and overworked results in an increase in nurse suicide. Even when the individual reaches out for help, there is no guarantee that their resources are being provided to them. The request can be overlooked because the healthcare industry may need them more as a number or more as a person in the field to care for patients. Which brings me back to the program of Healthy Nurse, Healthy Nation. If this program is being created to help our nurses to feel a sense of appreciation, then why is so many stories being written of healthcare industries turning their backs on their nurses and disposing their employees the second a mistake is done? In January 2018, an article called Nurse Suicide, Breaking the Silence was written by Dr. Judy Davison and her colleagues in University of San Diego. Wanting to spread the awareness of nurse suicide and mental health surrounding this career of nursing, there was little to no data found in nurse suicide. What this means is that suicide rates of physicians, teachers, firefighters, and military was more presentable than those of nurses. And yet nurses are the ones that are face-to-face with patients every day, face-to-face with challenges every day, face-to-face with those who are in harm, illness, face-to-face with challenges such as diseases, harmful patients, harmful to themselves and to others, as well as Finding these in January 2018, an article called Nurse Suicide Breaking the Silence was written by Dr. Judy Davison, a nurse practitioner, and her colleagues of University of San Diego. Wanting to spread the awareness of nurse suicide and mental health surrounding the career of nursing has grown and what it has grown to be. However, the research fell short when searching for data covering nurse suicide. Suicide rates of physicians, teachers, firefighters, and military was presentable, but no data of nurse suicide was found. Finding it strange that this career being one of the most mentally draining and physically straining on the body, there was no results on what aspect of the effect had on the individual. There was little to no evidence documented on how nurses were affected, especially in this day and time, nurses are being held more responsible and accountable for patient care than any other healthcare worker, causing an even more amount of stress to their overall health. With the increase of accountability, there is also the feeling of isolation that plays a role in nurses. A career in nursing, we are taught that delegation and teamwork provides the best care for our patients. However, a nurse speaks about her experience of when being transferred to a new position after being an ICU nurse for many years. This new position placed her in an unsettling atmosphere. The unit was not welcoming. The unit was not able to provide teamwork that she was used to. And further down the line, the nurse was feeling very isolated and the nurse spoke about how the unit was very task-oriented and didn't speak to one another about their day-to-day, which is very important when it comes to nursing and the cause of mental health. Treating mental health can be challenging, but due to that every mental health patient, there are several ways to treat it, one of them being group therapy. With group therapy, there are many ways for the individual to feel welcoming and not so alone, because they are surrounded by others who are in a similar situation that they are in. Along with the 6 pillars of Healthy Nurse and Healthy Nations, nurses need to understand that leaning on one another instead of the expected society of our senior nurses eating their young, nurses need to understand that leaning on one another in similar experiences and emotions can have a sense of healing when feeling overwhelmed and underappreciated. Having others around who struggle with similarities can be beneficial to keep nurses not only in this career but also out of harm's way. We are spoken about the pledge nurses take when starting their career: do no harm. And that should be extended to those that they work beside too. Lending a hand or a moment of safety to speak freely can help their coworkers and others feel less lonely and less helpless.